Hello, my name is Teresa Su, and I work as a senior research advisor for SIDA. In addition to that, I work with HRP, and I am the chair of the governing board of PCC.
My name is Lale Say. I'm the head of the unit working on sexual and reproductive health integration in health systems in the Department of Sexual and Reproductive Health in WHO Geneva.
I'm Dr. Suchi Gaur. I am the Director of Global Engagement and Impact at Worldwide WCA, which translates into me looking at communications, programs and advocacy work and everyday strategy of Worldwide WCA.
My name is Julita Onobanjo, and I'm UNFPA's Director for the Technical Division in New York.
My name is Maha El Adawi, and I am the Director of Healthier Populations Department in the Eastern Mediterranean Regional Office of the World Health Organization.
Learning by Sharing portal came about with the understanding of the large gaps in evidence and implementation experience in including sexual and reproductive health in universal health coverage plans. As more and more countries are moving towards implementing a universal health coverage in their countries to improve the health of their populations. While countries are doing that, the evidence on how best to do from a sexual health perspective have been limited, and they were dispersed in different resources. So there are evidence in scientific literature, there are evidence from country reports, there are evidence shared in conferences and meetings, but we really wanted to make sure all this necessary information is placed in one place, on one platform, where people can go to and look at and search and find information they need.
So as a co-convener with WHO, UNFPA is just really extremely excited, deeply invested and really fully committed to the learning, sharing and the knowledge efficiency that this new portal offers in our efforts to advance sexual and reproductive health and universal health coverage.
We also have a steering committee that is composed of external stakeholders from different perspectives, from research perspective, from implementation perspective, from policymaker perspective, to guide us in developing the content and the quality of the portal. So UNFPA and WHO are very proud to work on this together, but we are also grateful to our steering committee members to have that scientific oversight in the development.
One of the key things that I see as a big gap is looking at the issue of SRH from an intersectional lens of not just, health and the impact it has on other aspects like mental health, but also looking at it from an aspect of gender-based violence, conflicts that are existing in the countries, and the situation around funding and how women and the other genders, marginalized genders, are excluded from the conversation.
I think when we say universal, both in universal health coverage and universal access to sexual and reproductive health, we actually mean everyone, and no one can and must be left behind. Indeed, UNFPA works to leave no one behind and to reach the furthest behind, ensuring the inclusion of all marginalized communities, persons with disabilities, migrants, indigenous people, people of African descent, LGBTQI persons, and all population segments.
When we address gender-based violence in the health centers, this is an area of comfort where women can have access to medical care by whether a physician or a nurse or a midwife, and they have the freedom to speak, to express, and also where they can receive care in a much better way.
One of the things that we see lacking many times is adolescent health and migrant health, and really including all people in all countries of all different ages and situations.
I think it is important that elements of what is considered a comprehensive bundle of sexual and reproductive health services are not left out. Elements such as access to comprehensive sexuality education, to comprehensive abortion care, to detection and management of reproductive tract cancers, to STIs and other counseling services on sexual health.
It's important to understand how this is done, and that's another important issue, and to share good examples and experiences that are being made out in the world right now. So looking at different cases and sharing these stories, talking to each other, peer-to-peer learning, countries where you share similar experiences and challenges to find ways forward in this very important issue. There's a gap when it comes to how are the processes and how is decision making going on in different countries? Why are some interventions included, while other interventions are not included? So there's a gap when it comes to evidence there. And we need to understand that so we can advance the agenda.
Sort of pressing issue is really political commitment, and that political commitment to sexual and reproductive health that translates into financial investments that ensure equity in access, quality of services, and financial protection.
I think it's also very important to know that we need to connect researchers with the decision makers and the different stakeholders, both to share the evidence, but also to do the priority setting. Where are the gaps? What are the needs amongst people and communities? So we need to involve the different stakeholders in this area. And there is also a challenge to get these people ourselves actually, to meet and to understand what the needs are.
We see very in-depth researches, but we rarely see the interconnections with the work, the theme. And I feel like with looking at it from a universal health kind of a approach is instrumental in the intersectional side of how critical SRH is. Very often I feel like we do these kind of very heavy top researches. We go and we speak to the community, but nothing gets flown back to them as to what is the next step, where are we closing the loop. And I feel like we are missing on closing the loop, because that's where the community gets disappointed and there's lack of accountability from our side. So I feel when we look at the issue of SRH and universalization of health, I feel it is critical to look at it also from an angle of community, and how closing the loop with the communities is important, because at the end, we're doing it for them.
We expect with the use of the Learning by Sharing portal by different stakeholders from different countries to create a cross linkages between the users of the portal. And we will be also developing a community of practice where the ideas, the experiences can also be shared in an interactive way across, not in a passive way, but in an active way by the users of the portal.
This is the whole idea of having a portal for learning by sharing. It's by definition, I think it's a beautiful name in a way, because we learn by sharing experiences.
Our core is that when countries are defining their national UHC policies and plans and the complementary benefit packages, they must commit to and have strategies in place to secure the full integrated package of SRHR services across the life course. And if one has to start with a smaller prioritized package based on available financial resources, then simultaneously structures and strategies must be defined for a progressive realization of equitable and universal access to comprehensive package of integrated quality sexual and reproductive health and reproductive rights services by 2030.
So the vision for the future, so we have the Learning by Sharing portal where you have guidelines and tools and the stories. So a vision would actually be to have it more interactive, so you can directly get in touch with people who share the same challenges. There can be seminars on the platform where you can directly go into some of the tools in your country or on global level and start to talk to each other. So that's my vision, at least, that this will inspire for connections and interactions between different stakeholders in different countries, and especially between decision makers, policy makers, the researchers, the communities, civil society actors, industry. So if there is enough interesting information for all of these different stakeholders, there is a great potential to really to advance the agenda.
People say that COVID-19 was a disaster. Yes, completely. It devastated the world. At the same time, it made us see all the gaps, and now we are working to fill those gaps, and that's the hope we all are carrying. And I see that the same way, the gaps that have existed in the way the researches have been done versus how stories have been told. I feel this Learning by Sharing platform is doing that, like filling those gaps. And that's one of the key roles we need to play for the future, because systems have operated in isolation and not interacted with each other, and we can't go that way for long.